Okay, this could very well be a show. And the reason I know
could it very well be
that this could be a show is because of
because we're already going.
We have a way of monitoring it that shows us that there is a show. There are comments. I'm sorry I can't put up the comments. I'm sorry I can't put up our usual screen that we watch, which is where we usually read our comments. But welcome to the Auburn Medical Group with YouTube is not receiving enough video to maintain smooth streaming.
Not enough.
There may be a way I can open a widget for that and just kind of turn the stream settings to not super fast and stream latency. There we go. Just hit it. Oh, you can't do that after the fact, huh?
I don't know.
Isn't that interesting? It was working better off of the other setup than it does off of. So welcome to the show about gallbladders.
Hopefully,
we're going to be. We already have comments. Laura Webb, hello from Tennessee. Well, hello in Tennessee. Hello from California. Thank you for coming to the show to talk about it. It looks like it's going to be about gallbladders, unless Laura Webb, you have some other topic.
Gallbladders.
And Yahtzee's also saying hello, doctors. Apparently, they're getting better reception of us than we are.
Oh, that's good.
They're commenting, and we appreciate your greetings. Why did the idea of gallbladders come?
Oh, well, it was the topic at
your dinner.
And my Thanksgiving dinner. So, yeah, it was on the top of mind of a few people who I was sitting around because a couple had recent gallbladder attacks. I think one was actually scheduled for surgery. They were on very strict diets, and a couple other had already had their gallbladders out.
Yes.
It was,
wow.
Yeah.
So I don't know the medical history of everybody we had Thanksgiving with. I don't. So it's possible that two people who were there could have had their gallbladders out. And I wouldn't know because I don't know their medical histories. Children, and I'm pretty up on theirs.
Probably know theirs.
It could be that one of my children secretly had a gallbladder attack and scheduled surgery without having their physician father know.
I was going to say, I think you would be the first person to know. Dad gets where I am.
Knowing sex and calls we get, I'm pretty sure I would know if one of them had surgery for the gallbladder. So I believe nobody at our Thanksgiving ever had gallbladder problems.
Well,
maybe other medical issues, but
yeah. How much fat was your Thanksgiving dinner versus mine?
Okay. Oh, this is the chance for me to remember 4 things.
There we go. It was 3 days.
There was no turkey.
No turkey. We had turkey.
We had chicken cordon.
Wow.
And the rest was pretty much regular
turkey
size that you would have with
stuffing.
Yeah. Well, no, not
mashed
stuffing.
Potatoes.
Sweet potatoes.
Cranberry sauce.
sauce.
Difference between sweet potatoes. Yep, definitely cranberry sauce, the good kind with sweet kind.
I made green bean casserole.
Oh, they say it's not working, so I'm not sure.
It's just not working.
Or the repeating
comment. That's what they keep saying.
It's not working. We keep
freezing.
That's from a couple of different people. Sorry.
If
you eventually get this.
I know this is not our usual.
We're just really good at freezing.
Actually, I sent it through that. So it worked better with OBS. The latency,
we're trying.
I guess you can't change latency once the stream has started.
Well,
that would be really stream status.
They'll eventually catch up.
If I do it the other way, they won't hear us.
I don't know sign language that.
It's not working, Doctor. Thank you, Yahtzee. Darla Whitmire, you keep freezing up.
Yeah, that's what I was seeing too.
It's a dance. We're doing it on purpose.
But are they actually able to understand what we're saying? I guess they understood that we're talking about gallbladders, but
the stream's current bit rate is lower than the recommended bit rate. We recommend that you stream a bit rate of, well, sure, okay. Great suggestion. Yeah, that's why don't you carry the show while I
carry the show? I'm every 5 seconds, so I'm not sure what
Well, I
carrying.
see if I can somehow change the string.
Gallbladders. Should I talk about gallbladders, or should we wait until we have a better stream?
That's the question.
So people don't just catch every fifth
word.
Freeze every 5 seconds, whatever it is.
Yeah,
That would be hard to follow.
I know. I'm sorry. I'm looking to see if I can change the stream. I know where I want to change it.
Is it better now? Maybe people can comment.
I didn't do anything.
Nothing's changed.
But that's where I want to change it. That's where I want to change it, right there.
Live.
And
to see what I'm catching here.
I have an idea for another place
freeze.
where it might. No, that's just worthless. We'll just take that off. And I don't want to end the stream.
Yeah, then we'd have to make a whole new one.
Well,
We'd have to
nobody would even be there, though.
hop over to a different one. We could go to a different stream. I can say that word.
Unless live replay stream ends. I'm looking for it. Once you started, well, they really don't want to watch me.
Yeah. Try it. I don't know.
The other way, there was no audio, though.
Thanks for sticking with us. If you can hear us.
Yeah, those who are still.
I'm scared off by our.
Why does it say 1440p and 4K resolution? We don't. People with 4K.
Don't need that.
Oh, the stream set. Okay. Can I edit it here? Stream status good.
That says good.
Good connection.
Are we finally to
We
something?
want.
Are we good?
Are we good?
I don't know.
Stream status. Those are things about the stream, but
Yeah, you're here for me as well.
I know.
I am understanding what you're talking.
But they understand what we're talking about. So let's go on with
Talking about.
why.
We'll try talk about golf.
So one of the explanations. I'm sorry. I'm so distracted. Thing going on over here.
Yeah, it's a little.
So one of the reasons for the gallbladder issue between our two parties has to do with.
Yeah.
It might.
Yeah, the people who had or were slated for surgery were older.
Like probably
all older than me.
our age.
I think all older than me.
Yeah.
One of them was actually probably he's older. Yeah.
Over the 4, however many you come up with.
Yeah. So when we're in medical school, we talk about risk factors for getting gallbladder disease. We talk about risk factors for anything, but there are certain things. Gallbladder attack, whatever you want to call it, but they are all Fs, some of them not politically correct. So one of them is...
So we'll get them anyway. We'll tell you.
Who are fertile, meaning in your childbearing year, over age 40, and the last one is fat or overweight, obese individuals are more likely to have. So fat, fertile females over 40 was how I was taught it. For you?
Was there another?
Fair.
Fair. I don't know what fair meant.
Fair. White? White individual?
I don't know if. Also, I don't know if these are evidence-based. I think be based on people.
So what they see?
Passing them on generations of doctors.
That's entirely possible.
This can happen. And so you just kind of make these assumptions instead of having, evidence to show one way or the other.
Yeah.
So I actually No.
So yeah, when I
How
said that's
much?
why he was a little astonished when I said it was a he. It was my sister-in-law's dad. I think he's almost 80, maybe 80. So he's an older individual too.
Okay.
Gallbladder attack. So gallbladder attacks. What do they feel like?
I understand they're very painful.
Yeah,
I'm
it's very
just getting
painful.
stuck.
When I was talking to, I think she's a little older than me. She was saying that it was worse than childbirth, and she's also had a kidney stone. She said this one was worse than a kidney stone.
Should we show some anatomy?
Sure.
Okay. This is the liver in a little model
Liver.
here. And if I pull, and this, it would be, I guess it'd be about this size in a person this size. This is very.
Yeah.
Livers in adults to usually be larger than this. And I'm turning it around, and oh, look at that green thing there.
Green.
That
Such an interesting color for something inside of you.
That's full of green. Right. You can't really see it from the front so much. I can because I'm right here and I'm looking at this edge of this liver here on the right side. I see just the faintest little greenish color here. Gallbladder is just at that bottom edge of the liver, and that so well where that is and how it pokes right there.
So you can actually, you can stick your under the rib. People are having gallbladder attacks, and there's this maneuver you can do where they take a deep breath and it kind of allows the liver to slide down, and the gallbladder fingers that are hooked under there, and it causes pain in those having a gallbladder attack.
So it's you have them breathe in such a way that when your hand is there, the liver comes down, pushing the gallbladder,
right again
with the breath, so it touches that finger, and they
typically when
a positive mercy sign, as this is called, is when the patient is no longer on the bed, because it hurts so bad.
So typically the pain is in the right upper abdomen. However, I was talking to these individuals, and each of them had different stories about how the pain was. One of them said, mine was more in the middle. We call that epigastric area. Another one said he had the back pain. Sometimes you can get pain over your scapula or your scapula in the back. But they don't always follow the rules that we set forth for them. No. So, it's something that can sometimes be a little elusive. And then the other, have an attack. What do you do with that?
Once it's already started?
Yeah. Not a lot
pain
you
medicine.
can. There's not a lot you can do.
Go to the emergency department.
And often the pain will resolve or significantly improve by the time that we're to the point where we're like, okay, do we need to or get a surgery?
Yeah.
Often it'll resolve. The pain is from a stone inside the gallbladder falling into the little duct, getting stuck there and trying to push fluid or push that stone down. So that can be extremely painful. But then if the stone falls back into the gallbladder, a big sac there, the pain's gone. It's essentially much improved.
Till the next time.
So that's why they say, should we consider surgery to help prevent this? And often dietary changes to help prevent that as well.
It's actually triggered by the fat.
Yes.
What you're eating is the fat stimulates the squeeze. So
yes,
that's why it's something that. And some people just totally change their diet and not.
Right. Yeah. And our Thanksgiving dinner, one for the non-gallbladder people that had all the butter and all of the fatty foods, and then and then the gallbladder meal, which didn't have any of those fatty foods, things they could eat.
Yeah. Maybe I should be.
Well, yeah. I did not eat food from that group. I ate food from them. Yeah, I had butter. For now. Yeah.
Okay. So we do comments or questions related to the show. Probably something in addition to you keep freezing up.
Hopefully.
Darla Whitmer had gallbladder out at age 20.
That would be kind of young.
Oh, man.
Yeah.
Laura Webb, she knows that but she understands what we're talking about. Gallbladder attacks hurt really bad. I broke all those rules, Darrell. I broke so far, I think the only rule had to do with what you're eating, and the rest was just...
Well, all the rules for like what, maybe talking about what we say is a gallbladder attack, what we look for. Yeah, people present differently and can show themselves in different ways.
Nisi says, I recently went to my annual physical and they couldn't get an accurate blood pressure reading because they can't hear it. What is that? How to fix that? We're going to have to do a show on that sometime, won't we?
Huh.
Nisi, please come back to a show in the future when we come.
Yeah.
So after gallbladder surgery, because you said
so typically is if they're recurrent, these attacks, or if they're severe, or they see changes in the going on for of that muscular sac, they'll take it out. A surgeon can do that surgery. It's a pretty common surgery, one of the common ones, and a pretty low risk surgery. Actually, going through the surgery, they have to deduct and then remove it. So there's a little risk there with that clipping affecting the rest of the duct. You still need that duct.
There is an artery there.
And you're right, there is an artery. That's why surgeons do these things, who have a lot of skill and experience. So you need that center open so you can get pancreatic enzymes down into the bowel. And also, you still need...
I think it's more the bile. I think the pancreas is still...
That's a little lower.
Further down.
A little lower. I mean, it would be unlikely. Yeah. But yeah, you still need those bile fluids to come into but it's essentially, you're still making those. You just can't store it anymore because you're gallbladder. So that can sometimes cause issues.
So it's not waiting for the next meal.
Yeah, so it's essentially
need it
on demand or continuously.
It's just,
it's longer on demand.
It's going from on demand to continuous is what's happening when you,
Yep.
No more reservoir to store it in.
Right. So you can overwhelm and sometimes eat too much fats where your continuous supply is just not going to be enough. So you can get diarrhea with kind of greasy, fatty stools. And sometimes those will just keep going because it's continuous. Sometimes that in itself can give you some symptoms as well. Diarrhea is the most common cholecystectomy gallbladder surgery.
Again, can be modified by your diet.
It can.
So we're actually encouraging people to eat a heart-healthy diet.
It's the same thing, yeah. Trying to avoid the fats. The tough thing is that this is not discriminated between good fats and bad fats. Any fat that goes into your body, even the good fats, the ones from vegetables and avocados and nuts and seeds, can produce a gallbladder response or need those bile acids. Yeah. So you do lose that. Yeah.
All right, let's see if we have any more comments we can get to. Okay, I'm going to skip some of this here. Stones developing any other organs from the use. Have you heard of that?
No.
I would think somebody would have to be really doing it a lot to have it influence stone development.
Right.
Even can.
I do.
Sorry.
I do not know that.
We'll have to check into that.
The other place we get stones is kidney stones. Sometimes people say, a stone's a stone. These are completely different stones. When we talk about gallstones versus kidney stones,
a stone's a stone.
I've heard people confuse the two. They're completely different. So one of them is in the urinary system going down to your bladder, whereas the other one is you're in a duct that goes into your bowel. So
salivary stones, umbilical stones.
Yeah, we once had a competition to see how we could name, but those are the two common ones. Bezoars. Wow, now you're getting into Harry Potter stuff.
Yeah.
Yeah.
I'm not sure how it connects to Harry Potter. Okay, so what we're going to do is make time to make our show not freeze up.
Understand.
Have our video at the front and the end, and our comments on screen again. Thank you, patience, for suffering with us through this show. We'll work on that. Sorry about that, Dr. Gawain. Sorry about the audience, but glad to put on the show. And maybe we'll talk about whatever Nisi wanted there with the
perhaps it'll be better when
The blood
people
pressure question.
replay it.
Yeah, maybe we'll find out.
Maybe it's
So-
just the live stream that we're having issues with. So,
And then Lindsay, bring you the show, and it's because of Lindsay. It's not usually. It's usually really cool because of Lindsay. If you absolutely had no other choice, could either of you remove a gallbladder and have a successful recovery? Okay, so this to the world of
this would never happen.
nobody else here has medical training. Going to get rescued in the next years,
Right.
and somehow I have all the tools and a sterile.
Yeah. Interesting.
So like last man on earth, and I could go to the hospital and just happen to meet the last other person on earth, and they're having a gallbladder.
And they're having it's
So
me
that's,
and this, it's
that's
me
the
and the
scenario
gallbladder.
that she's presenting me
End of the
for
world.
me to attempt something like this.
Right.
And I am going to be all over YouTube. Gallbladder.
Yeah. Oh man. Yeah, neither of us had surgical training, like true, like first surgical. I was
Right.
assist, a lot. And
Mine
a lot
was
of my,
cut here.
Yeah, yeah. It's
and it was
essential.
sutures I was cutting, not the patient.
Right. Yeah, hold this camera while we do.
Yeah.
While we do. So it would not be. Yeah, it would.
You would not
would
want
take-
us to do it.
Yeah, all that to say, we do not do these things for a reason.
And even then, if it was just pain and I didn't think it was infected, I may not. If it was infected, I would.
Oh yeah, they're.
If I thought somebody had an infected gallbladder,
have no other choice. They're
there
gonna
was no
die
other
anyways.
surgeon on earth.
Okay.
Yeah, I would hope.
Where's your anesthesiologist?
Oh, you have to do that too.
In this scenario. You're intubating yourself. You're monitoring.
No, not intubating the patient myself.
I know. I'm just
Not intubating myself.
Yeah, well,
I've done that before.
Wow.
Well, it was what was it called? It was one of those
A Mac or a.
the ones with the
Oh yeah,
the
yeah.
mask that
where
goes
it just
over
goes
the
over the
pharynx.
thing. Yeah, what it's called.
They had a name for those. They were really popular when I was in residency.
Yeah. I forget what they're called. Lateral